Chapter 33, Pharmacology and Preparation for Drug Administration. These are our objectives for Chapter 33. So, pharmacology is the number and variety of drugs. Well, one thing about pharmacology we need to remember is the number and variety of drugs have increased in the past decade. New drugs are going to appear on a consistent and regular basis. Some drugs have been around for forever. Other ones are brand new. A couple examples of medications that have been around forever are castor oil back in 1600 BC, insulin in 1922, sulfa drugs 1937, and penicillin 1942. The regulatory process, for approval to sell a medication includes several stages of testing on animals and on humans. Formal research studies known as clinical trials then test new medications, treatments, and medical services. New drugs continue to appear as medical researchers discover more chemicals that produce highly sophisticated effects on specific tissues and cells. Physicians, pharmacists, and nurses are legally responsible for safe and therapeutic effects of drugs. To prepare for a medication administration, we have to be able to locate the information about each drug, consistently calculate drug dosages accurately, devise a method for using 6 rights and the 5 rules of medication administration consistently, recognize the nursing implications. Nurses must be knowledgeable about all possible drug interactions. In nursing practice, we have to read and do our 3 checks. So we're going to make sure that we are checking our medications at our chart, our cart, and the bedside. So we want to make sure that we have the appropriate dose for our patient. We need to know the difference between the generic and the trade names for drugs. We need to know what is the desired effect of the drug, possible adverse reactions. Those are the reactions that we want to call the doctor about. Those are the reactions that we're concerned about that are not normal side effects. And we also need to be familiar with expected side effects that coincide with that particular medication. Drug-to-drug interactions, food-drug interactions, and we have to know how we're supposed to prepare the drug for administration. Is it going to be by mouth? Are we going to have to give it via injection into the muscle, into the subcutaneous tissue? Are we going to have to give it via IV? Is it sublingual, topical, so on and so forth? Many different routes of medication administration. We will talk about that more later. So generic equivalents are just as safe and effective as trademark drugs. Generics by law are identical in content to brand name. Versions. Generic drugs are usually less expensive. So we have each drug has 3 different names. We have a chemical name, a generic name, or a trade name. Drugs are classified by the effect of the drug, symptoms the drug relieves, and the drug's desired effects. A drug may belong to more than one class, like aspirin, for example. It's an antipyretic, it's an anti-inflammatory, and it's an analgesic. It also has anti-clotting properties. Nursing implications guide safe and effective administration. The following may prescribe medications. So physicians, dentists, osteopaths, veterinarians can prescribe medications. The following may prescribe medications in collaboration with a physician. So PAs, physician assistants, nurse practitioners, advanced practice nurses, all can prescribe medications. Legal control of drugs in a clinical setting include security of controlled drugs. That is the nurse's and the pharmacist's responsibility. The manufacture and sales of drugs are regulated by the Pure Food and Drug Act of 1906, the Federal Food, Drug, and Cosmetic Act of 1938, and the Comprehensive Drug Abuse Prevention and Control Act of 1970. In the hospital, responsibility for security of controlled drugs is again shared by pharmacists and nurses. Now we're going to talk about schedules. So we have schedules 1 through 5. Schedule 1 drugs are drugs with no accepted medical use and a high potential for abuse. Schedule 2s are drugs with medical use and a high potential for abuse and or dependence. Schedule 3 are drugs that are medically useful but with less potential for abuse. Schedule 4s are drugs that are medically useful but with less potential for abuse and Schedule 3 drugs, and Schedule 5s are drugs with medical use and low potential for abuse and that produce less physical dependence than do Schedule 4 drugs. So you can see Schedule 1s they have no medical use, and our Schedule 5s are they have the lowest potential for abuse. So that's the way the scale goes from 1 to 5. So to obtain FDA approval, a drug must meet standards in 5 areas: purity, potency, bioavailability, efficacy, and safety. You have to know these 5 standards that a drug must meet. That is definitely a testable slide. We use drugs for different reasons. The drugs may be used for treatment purposes, palliation, diagnosis, cure, and prevention of disease. We have some basic concepts of pharmacology. Distribution, metabolism, and excretion. These terms describe what happens to the drugs when they enter the body. Distribution, the organs the medication reach. Metabolism is the actual chemical transformation, and excretion is the elimination. Pharmacokinetics is how drugs enter the body. They are metabolized, they reach their site of action, and they are excreted. Absorption is the rate of absorption is determined by a person's weight, age, sex, disease conditions, genetic factors, and immune mechanisms. Here is a wonderful figure I love that points out the different factors that affect drug therapy. We have clinical factors such as age and weight, other health history, and the patient's drug compliance. What does compliance mean? It means, does the person take their medications every day? If they do, they are compliant. They're following their drug regimen. If they're not compliant, that means they're not following their drug regimen. For drug administration, we have to think about the drug form, the route in which we're going to give the drug. Multiple drug therapies, is the medication or is the patient taking more than one medication? And drug interactions, is there any interactions that could potentially occur? Pharmacokinetics, again, is the absorption, distribution, metabolism, and excretion of the drug. Pharmacodynamics include the onset, peak, and duration, therapeutic range or the therapeutic window, and then side effects and adverse reactions. We have differences in the absorption depending on the route of administration. So when we're giving the medications transdermally or through the skin, the medication is going to absorb slowly. Mucous membranes is quick absorption. Respiratory tract, quick absorption. Oral is also slow, and subcutaneous is also slow. Intramuscular is going to depend on the form of the drug, and intravenous is going to be the most rapid route of administration for absorption purposes. You want to remember that intravenous or IV is the fastest, the most rapid route of absorption. Factors that affect drug action are biologic membranes, such as the blood-brain barrier or the placental barrier. If a patient is taking two drugs that are protein-bound, one drug may have a higher concentration in an unbound state. There may be a decrease in kidney or liver function. If a person has a decrease in kidney or liver function, they oftentimes have more of a potential for them to reach a drug toxic level. So we have to monitor their drug toxicity levels very closely in these particular types of patients. Inadequate fluid intake may result in a decreased output, also resulting in drug toxicity. Chemotherapy drugs often require biologic monitoring because some medications require the biologic monitoring to determine the positive or negative effects on the body organs. Those drugs are very lethal, very, very, very potent, and so we were going to monitor those patients very closely. The study of the drug's effect on cellular physiology and biochemistry and its mechanism of action is known as pharmacodynamics. The primary effect is the desired effect. The secondary effect may be desirable or undesirable, causing side effects, or unintended actions, or adverse effects, very undesirable effects with more serious outcomes or consequences. So you have to know these definitions. Onset begins when the drug reaches the minimum effective concentration level. Peak occurs when the highest blood or plasma concentration of the drug is achieved. Duration is the length of time the drug exerts a pharmacologic effect. Drugs that produce a response are agonists, and drugs that block a response are antagonists. The possibility of adverse drug effects, side effects, allergic reactions, and undesirable interactions with other drugs and foods increases with the number of drugs administered. Toxic effects are harmful effects. We do not want that to happen. We have four different types of drug action. Drugs can either stimulate or depress. They can replace, or they can inhibit or kill an organism, or they can irritate. So stimulation and depression, that is direct action on a receptor site. Replacement, a good example of that is insulin. Inhibition or killing of an organism, that is antibiotic all day, right? And then irritation, a good example of that is maybe a laxative, that it's going to irritate the colon wall, hopefully spiking some peristalsis and then eventual defecation. Medications that have been taken orally can be affected by food in the digestive tract. Food in the stomach can affect the drug. It can speed up, reduce, or even prevent the absorption of a drug into the bloodstream. Delays emptying of the stomach, thus may delay the onset of therapeutic effects of the drug. Acidic gastric juices may affect the rate of the tablet breakdown. Some drugs are incompatible with others, so some drug actions are accentuated or improved or increased by other drugs. Others have an additive effect, and others may inactivate another drug. Medication administration and safety. As a nurse, you have to analyze the physician's order and determine if the drug, the dose, and the timing of the drug are appropriate for the patient. We have to be aware of usual dosages for an adult or child for each drug. We want to be responsible for monitoring lab results related to the drug and drug administration. Errors can be life-threatening event for a patient, and a patient's safety must come first. Things that we have to consider when we're giving drugs to infants and children. We always have to keep in mind what their age, their size, their weight is. We do not give children and infants drugs at a standardized amount. We're going to always check with the child's parents for most effective, least traumatic way to give a child some medicine. And we do not want to equate medication to candy. That's not a good way to do it. Now, what we need to remember about our older adults, they may have chronic medical conditions, so metabolism of the drugs may be slowed. They may be on long-term anti-inflammatory drugs for arthritis, or they might have some difficulty swallowing. They may need a pill organizer to help remember to take the pills. They're more likely to have blood pressure fluctuations. They may become quickly dehydrated. They might have decreased kidney function. They might have limited financial resources, limited vision, previous stroke. They might not be able to open up those child-proof bottles, and they might be non-compliant for a number of reasons. Things we need to remember about home care. Be certain that a patient or caregiver can open the medication bottles or the dispenser if they have a dispenser. A pill organizer may be needed. Written instructions should be left for the patient and their family members or home health aide. Verify that the patient can obtain needed medications. If a caregiver is to administer medications, thorough teaching must be performed. Question number 1. Drug standards that must be met by manufacturers include all of the following except number 1, purity, 2, potency, 3, price, or 4, safety. It's going to be 3. Price is the correct answer. That is not included. It's not a standard that must be met by manufacturers. All right, next slide. Question number 2. Amanda's patient is 80 years old, and all of the following are considerations that must be made when administering medications to an older adult patient, except number 1, older patients may have chronic conditions and may be taking multiple medications. 2, metabolism of the drugs is slowed in an older patient and normal doses may build a toxic level easier than in a young adult. Older patients may need a pill organizer to help them remember which drugs to take and whether they have taken a dose. And 4, older patients should have no difficulty reading labels because they usually wear glasses. That's right. Answer number 4 is the correct answer. Older patients often have very limited vision and can misread the label on a medication container. They should be encouraged to have another person verify or color code medications, or we can have them have their Medication bottles have the print large put on there larger, or have a list of medications so they can read it. Question 3. Lola is giving her patient an oral medication. Her patient wants to know how quickly it will take effect. Lola's correct response would be, number 1, your medication absorbs slowly, so it will take a while. If you do not begin to feel better in 30 minutes, please let me know. 2, your medication absorbs rapidly, so you should feel relief quickly. 3, you're taking the medication in the most rapid method of administration, so it should be very quick. Or 4, I don't have any idea. Okay, so the correct answer is number 1. Oral medication has a slow absorption rate. It will take a while to take effect. Skin and subcutaneous medications are slow as well. Quick absorption includes mucous membranes, respiratory tract, and the quickest is intravenous. All right, second section of chapter 33. Just have just a few slides for this section. So, problems with non-adherence. Medication is expensive and many people do not have the extra money it requires to purchase their prescriptions. So, financial barriers are very common. Sometimes they don't understand what the drug is and why they have to take it. That's another reason why they are not compliant or they're non-adherent. They can't tolerate a side effect of the drug. So if all of a sudden they start taking a medication and they have violent diarrhea, of course they're going to not want to take it anymore. They can't tolerate that side effect. We already talked about financial. They do not like to have to depend on a chemical to get well or to maintain health. So it's always important that we try to get to the heart of the problem. If there's a non-pharmacological solution to people's health issues, we should always explore that avenue before moving to pharmacological therapies, in my opinion. When we are applying the nursing process, we want to assess the patient's condition. Check for positive allergic reactions to the drug. Know the side effects and the synergistic potential, if there is any. Take vital signs or know recent readings before we are going to give the medication. It's very important that we know what medical condition is being treated and with the drug being administered. So if your patient has high blood pressure and you're giving high blood pressure medications, antihypertensives, you should be saying, okay, I'm giving lisinopril because this person has hypertension. You should be double checking, making sure that what you're giving the patient makes sense for what is wrong with them. You should also know how the drug works. How does this drug work? What is it doing inside of the body? And also contraindications. Now, do you need to memorize all this stuff? No. You need to use your drug book. Know whether the medication will affect the person's vital signs. Again, you'll learn this over time. However, as a new student, you need to use your drug book for all the medications that we are going over. Get your drug book out, look it up. Know and assess for side effects. Never give an unfamiliar drug. If you don't know the medication, even if you have heard the name, it sounds familiar, but you can't remember a lot of the information about the drug, like therapeutic dose, common side effects, what the result of giving the drug should be, you need to look it up. Always, we're going to do our 3 checks and our 6 rights. Our 6 rights include the right patient, the right drug, the right dose, the right route, the right time, and the right documentation. Here is a picture of the nurse checking the barcode on a patient's wristband to make sure they have the correct patient. We're still going to ask our patient, what is your full name, first and last name, and what is your date of birth? And are you allergic to any medications? I'm going to ask my patient a few more questions, but we'll talk about that later. Here is a picture of pouring the pills from a patient's own supply into a vial cover. Anytime you give pills, you always want to do it like this. You're going to pour the pills into the cap, and then from the cap, you're going to pour into the medication cup. Medications are always supposed to be given by the person who's preparing them. Do not give a medication somebody else prepared. You don't know, maybe they're trying to kill this person. Who knows? We don't know. But if you do not draw the medication, if you do not take it out of the pill bottle and put it into the medicine cup, do not give it. You don't know what is in that medication. Medications are not to be left at the bedside. We don't leave them at the bedside. We don't put them in the trash can. Nothing like that. We are to make sure that we are in control of medications at all times. Narcotics and controlled substances are to be kept under lock and key. Orders must be checked before drugs are given. Distractions must be avoided when medications are being prepared. And the nurse must know the drugs being given, their action, the dose, and any precautions. When Heather administers a medication to her patient, which one is not one of the 6 rights? Dose, drug, doctor, patient. You guessed it. Number 3. Doctor is not one of the 6 rights. 6 rights are drug, dose, route time, patient, and documentation.